Hello, Dr. Oreadi. Welcome to the International Dentist Podcast.
Thank you. Thank you. Hi, Gabby. How are you?
I'm very well. I'll call you Danny. So,
Yeah, absolutely. Absolutely.
so I would like to hear from you because although I know you for a while, I probably don't even know exactly why you choose the United States as a country to develop your dental career.
Yeah. Well, obviously, I was a little biased because I was born here in the States. So that's something that, uh, my dad actually trained in at Tufts. He's a periodontist. And during that time, I was fortunate enough to come to this world while they were here in Boston. And that's something that always stay with me, and my parents kept up with that and made sure that I kept my citizenship, and obviously it may not have had an entire uh, reason why I decided to come here, but it certainly was something that I kept in my mind all this time. So I went to dental school, and after I graduated in early 2000, I had already made my mind that I wanted to pursue my or further my dental career in oral and maxillofacial surgery. And back then, uh, such a specialty was not available in Venezuela. It was only oral surgery. I believe it was a 2 or 3 year long program, and I wanted to just give it a chance and see what were the opportunities I had. A lot of support from older or colleagues that had attempted or had made the journey and applied into the United States, and that's what I did, and it wasn't easy, but that's the reason why I chose the United States. And also we had some friends and families of my wife who lived here and helped us, to come in and get settled.
Which is very important to have that
Absolutely.
support system. But I'm curious that for those that don't know, what are the main differences between just oral surgery and a program in oral maxillofacial surgery?
Yeah, our specialty is complex. In Europe, you have to be an MD in order to become an oral maxillofacial surgeon. In some countries in South America, and more specifically, I'm going to speak about Venezuela, obviously, there is also a specialty that is simply oral surgery. And it encompasses what we know are the bread and butter of oral surgery. Essentially, the diagnosis and management of oral pathology, the management of impacted teeth, pre-prosthetic surgery, implant rehabilitation, sinus augmentations, bone grafting, things like that. When we go and talk about oral and maxillofacial surgery, it encompasses uh, more procedures that are mainly done in a hospital: orthodontic surgery, TMJ, head and neck oncology, reconstructive surgery that is beyond the scope that you would find on oral surgery. Trauma, the management of trauma and severe deep space infections, things like that. So that's the definition, the difference between the two. It is more towards the medical side, hospital environment. And here in the States, that's the only option, is to become an oral maxillofacial surgery. There's no such a thing as an oral surgery program. Many years ago, our training was about 3 years long. Then it changed to 4 years, which is what I did. And there's also the option of going 6 years and become an MD. So, you can think this, how far it stretches and how lengthy someone a career can be, depending on what you choose.
And what is a typical path for somebody that goes into oral maxillofacial surgery? Is that they go after dental school? Like, what is the common type of applicants that you see intending to do this program?
Yeah, for the most part, I mean, obviously, everybody's a graduate dentist that decides to apply to the program. Then, as an applicant, you have to choose whether you go through a 4-year program or a 6-year program. The decision is usually based on, or at least what I try to mentor our students is, you when you have to make that decision, you gotta look at yourself 5-10 years after you complete the program. What do you want to do? If you want to finish the program and go into a private practice, you may want to rethink the possibility of going through a 6-year program. If you want to, in the other hand, go and become an academician and even further your training with fellowship in any subspecialty, you may benefit from getting the 2 extra years and get the MD degree. But basically, the road is the same. It's a 4 or 6-year training to obtain the certificate in oral maxillofacial surgery. You both obtain the same. The 6-year program obtains that in addition to the MD degree.
I see. And for you as an international dentist, because you completed your dental education in Venezuela and you came here for the specialty, correct?
Yeah, that's correct.
What were the challenges for you as an applicant or as an international applicant to get in a program like oral maxillofacial surgery, which is very competitive in the U.S.?
Yeah, it's not easy, and I have to be honest, it has become even more difficult nowadays for many reasons, and we're not going to get into any specific reasons. So all I can say is that it is challenging. It is a lengthy program. When you come as a foreign graduate dentist, the road is more difficult because if you get to match into a program, then you will finish that program and you still will have a license issue, meaning that you want, and this, and this is what we talk about all the time, is how difficult it is in this country to show that we are qualified to practice dentistry in general. And yet we have to go back to school, spend time and money in order to get a license. So add to that the possibility of doing a 4-year or a 6-year program. It's a lot. In my particular situation, again, it was about 20 years ago when I came here. I started applying actually when I was in Venezuela, just before I graduated. And I saw firsthand how difficult it was, rejection letter after rejection letter. For many reasons, and I don't think grades have anything to do with it, because you can be the first of your class and still just the fact that you come from overseas is difficult. It's difficult for these programs to look at it and consider you a competitive applicant when comparing you to a graduate from the United States. So in my situation, I decided to come here and apply in person because I figured that doing it from overseas, from Venezuela, was going to be twice as challenging. And that's the first advice that I have. If somebody wants to further their training and come to the United States, you have to do that. You have to make that step. You cannot just expect to apply from overseas and get a phone call and say, "Oh yeah, we're gonna invite you for an interview." So that's what I did, and I realized even here that it was very difficult, and that's why I did. I was fortunate enough to do an internship training at BU. That was my first experience as a resident, essentially as an intern. What we call a non-categorical intern is that person who gets the position from July 1st to June 30th, 12 months, and then after that, you're done. If you don't match, you have to find something else to do. So I did that at BU, and of course I didn't match.
So during that year, you basically were the same as a resident.
Exactly the same as a first-year resident, doing every duty and taking care of every responsibility that you would take care as an intern in that position. And it was an eye-opening experience. I loved it. It made me realize that that's what I wanted to do. And I tell you, it wasn't easy, because there were days that I said, you know what, I'm not, this is not for me. And there were other days that I said, okay, I cannot see myself doing anything else. And then the next day I was like, okay, I'm ready to quit. And it was just this roller coaster of emotions. But once you realize that this is what you want, and this is not only applicable to oral maxillofacial surgery, this applies to everything you want to do in life. In my case, I realized, and even before I found out that I didn't match for the following year, that's what I wanted to do. And so, after that, I mean, again, as a foreign trained dentist in this country where you cannot practice, if I graduated from this from an accredited university in the United States, you finish your internship, you don't match, you go work, you go see patients at a private practice, make a decent living, and then just keep applying if you wish. But maybe that's what I needed. I needed to really struggle to get into it and really loved it. And after finishing that internship back in 2003, I found myself applying for jobs as a dental assistant, and I did that for another year, and another opportunity came up at Tufts this time, and I did my second internship there. And it was a do or die type of situation. I knew that if after that, and I had already talked to my wife and our families, I said, if after that internship nothing happens, we gotta figure out what to do. In my particular situation, I was ready to go back and just start practicing there. The one thing that those 2 years gave me was a lot of experience and basically a lot of training in the oral surgery aspect of the specialty. So I felt very comfortable treating and managing patients from the oral surgery point of view. Felt comfortable doing odontectomies for wisdom tooth removal, pre-prosthetic surgery, some implants and bone grafting, and I it was going to be an option. But fortunately, I really, one thing that I take a lot of pride is my perseverance, and that's what took me through that, and I matched that year. And if you think about it, and this applies not only back then but even nowadays, we get on average every year about 150 applicants to our program, out of which we select 22 or 24 for interview.
For how many positions?
For only 2. So it's a very significant and narrowed result for these applicants. And when you realize how difficult it is, and in my case, because of the fact that I was a foreign trained dentist, I only got one interview, and one interview only. One at BU because I was an intern there, and one at Tufts because I was an intern there. So, you can imagine, I mean, the how nerve-wracking is the fact that you are, just competing against so many good applicants, some of which, are probably more qualified because they're trained here. They had additional opportunities, and then, try to match in one of those 2 positions. Some programs have 3, but for the most part, it's 2. I think is the average.
And also, accreditation from programs actually don't even take international for
Exactly. So and now, for many other reasons that are completely inherent to the training itself, it's very difficult. A lot of universities just tell you right off the bat, if you're a foreign trained dentist, do not apply. We don't give that opportunity. Tufts still offers that opportunity to applicants, and there are a few other very little programs that offer that. So it's very difficult in general.
Even for you that you were American citizen because you were born here, but you're still considered, because you did your dental education in Venezuela, as a foreign trained dentist.
Exactly, and that is an additional limitation. Being having a different nationality, it puts you at an even lower position, or I wouldn't say that way, but it puts you at a more difficult situation when you apply to these programs. So, in my case, I mean, my nationality did not affect my application process. It was just the mere fact that I was a foreign trained dentist, and we do equivalence of our grades, but it's not the same when they look at it. Nowadays, it's a little bit different because back in my time, I still had to take the boards, the national dental boards. It was not a requirement, but it was recommended. Now, what CODA has done and has requested our programs is to have every applicant take a test that is called a CBSE, similar to the test that the med students take, the step one, and they have to, we use that grade as a measuring gauge for during the resident application review process.
And that applies for both 4 years and 6-year programs?
Yes, exactly. So everybody is required to take that test and score high. Obviously, the higher your score, the better your chances. However, I personally don't believe that grades in during your dental career or on that exam are to be taken as a sole characteristic for these applicants. I mean, I think that there's more than that. Obviously, the interview process adds a little bit more to that, but I think it's just an overall package that you have to show when you have the opportunity to interview for these programs.
Of course, because if you're considering like over 150 applicants or so, less than 20% get called for an interview. A big first gateway for this will be having a decent score to even being called for an interview.
Exactly. And a lot of those, I mean, we always ask, and they, some of them have 9, 10 interviews, others just 2, maybe 3 or 4. Some only get 1 or 2. I mean, especially if they're in the non-categorical position. So it is a difficult process.
So for you, once you have got that, because after 1 year been, I guess, working, you needed to also make a living. You had a family here, so you were able to work as a dental assistant that year. Then you got into Tufts, did your other extra year of intern, and you got it. Finally, dream come true after 3 years of hard working effort. Now you're into residency. What was the first shock as a resident?
There is always a benefit for those of us who do an internship. Is the fact that you have been training or practicing for that position for a full year. So, even when you apply coming off of a non-categorical position, you are being looked at as somebody who has an extra edge, a little bit more experience, because you already went through the process. You know how to manage a residency clinic and how to deal with orders and take call and stuff like that. So for me, after having done not only 1 but 2 at a different institution, just gave me a little bit of an advantage. Which means that during that intern year, I felt that I had it and I felt very comfortable. And I think my biggest shock was the fact that knowing that after, I mean, not so much 3 years, but that's a process. If you think about it, I started in 1999 and I ended up matching for the position in 2005, essentially. So that was 5 years. By that time I had already a 3-year-old son, a newborn daughter, and it was shocking, but it was something that I look back now and I feel very proud of. And training was hard, same way. It's just the life as a resident is not that easy. It has become a little better because there's an 80-hour week work rule that is now applicable and forced on every program. When I started at BU, there were 16-hour, 18-hour long days sometimes, and then you were able to go home, sleep, and then wake up the next day at 5 o'clock and just start all over. So, things got a little better in timing, but also it was long hours. The average day for a resident is usually 12 hours, sometimes 14. And you take call and then you go home, and every hospital is different. Tufts certainly different than BU, but every program is very busy. So it's not an easy road, but it's I'll say it's well worth it. And in our specialty is different in that way also.
Yeah, I guess that also applies to the way how the specialty carries on. Like the residency might be very different to other residencies, as well as it is even financially, because and correct me if I'm wrong, I think a lot of oral maxillofacial surgery programs also offer a stipend
That's
for
correct.
grants.
That's correct. The reason for it is what I just mentioned to you, is the hours. You essentially, you are a staff to the institution, to the hospital, because every program is attached to a hospital. It wouldn't work otherwise. And then residents, you stay call and they see patients at a hospital, and they receive a stipend as residents. Not to mention that I think that, not in my time, but nowadays, none of the programs have tuition. So it's a big difference when you compare oral maxillofacial surgery with any other program in any university. And I'm not talking about the times, because we know that other programs, you know better, PROS is not an easy training, and it's long hours as well. So every program has different challenges.
I think part of that, and what you mentioned, is key. The fact that you also staff from the hospital and you participate, it's like almost dual institution. You have responsibilities as a resident that belong to the Tufts, like the dental school particularly, but you also have a lot of responsibilities that come from Tufts Medical.
Exactly. And this is why I always call our specialty a hybrid that is not well understood by either the dental or the medical profession. And this is something that I could write a book about, because to this day, a lot of our colleagues at the dental school have no idea what we do, and a lot of our colleagues at the medical school wonder why are we doing certain things. so so it's that has certainly been something very interesting to me all these years. I to the point that I just I'm done explaining. If somebody asks me and really shows interest in learning and understanding, I'll explain. But if somebody comes to me and asks me while I'm doing a neck dissection, are you taking teeth out? I go like, sure, maybe, I don't know, and vice versa. So there's a lot of in my mind, is challenging enough to educate the public about oral maxillofacial surgery. Imagine if I have to do that, to our colleagues on the dental and the medical field. So it's a lot of work.
You mentioned the word hybrid, and I think that actually hits the nail, because that's exactly what it is. It's a blend. It's really a blend.
Exactly.
And if you look at having the opportunity of doing a 6-year program and actually becoming an MD, that's how close it is.
Yeah, exactly. When you can get your MD degree in 2 years, but that applies to, I think that every medical student, if they want to do it before oral surgery training or not, they could. I think that the easier way is to do it during a OMFS training, during the training program. But yeah, a lot of those who go through the 6-year program do it for that reason, just to have it there, and at times not have to explain, based on what they end up doing.
And will you mind elaborating what happened in those 4 years? What is a typical 4-year path, or what was it for you?
Absolutely. So, the first year, as I mentioned, you essentially focus on learning about oral surgery. You manage the oral surgery clinic where a lot of the emergencies are seen, patients that are referred from other programs. Let's say PROS refers somebody for full mouth extractions. There is a consultation that the intern will do, and then the procedure. They also have a didactic schedule where they receive lectures of multiple topics. Medicine for the management of intravenous and ambulatory general anesthesia patients, and multiple topics in our specialty. They take call, they share responsibilities with other residents in making sure that patients are ready to go to the operating room. They follow these patients while they're in the hospitals, round on them. Then on your second year, go back. During your first year, you also rotate for 2 months through departments in the hospital, the Department of Cardiology, Pulmonary, and also Internal Medicine. So we're getting you ready to go into your second year, where you are not seen at the Oral and Maxillofacial Surgery department because you are part of the general surgery program at the hospital. So you do 6 months. At that point, you do 6 months of general surgery, whatever services you have to cover. The surgical intensive care unit, vascular surgery, transplant surgery, bariatric surgery, plastic surgery. You do a month of either service, depending on what you have to do. Then you do 5 months of anesthesia and 1 month of ENT, which is otolaryngology, ear, nose, and throat.
So basically, for a whole year, you're out of the dental buildings.
For a whole year, we do not want to see you. You spend your time under the observation of the general surgery department and the anesthesia department when you are doing those 5 months. So we have 2 residents that essentially go. One starts on general surgery, the other one starts on ENT, and then does anesthesia, and then they overlap, and the other one does anesthesia, finishes at ENT, while the other one does 6 months of general surgery. So that's the second year. Then when you come as a third year, you are essentially doing oral and maxillofacial surgery. It's a tough year because you have to manage your interns, and you also have to take a lot of responsibility from your chiefs and your faculty. So you want to do your cases, you want to start learning, you want to start focusing on what you're going to end up doing and preparing for by the time you graduate. Chief resident year or your fourth year is great because all you want to do is operate, and that's what you do. You go to the OR with your faculty, and then you operate on those cases. You manage your cases in the clinic. You do the ambulatory general anesthesia cases and so forth. During all this, you have also to fulfill an academic responsibility. There's also a research component that we want you to create a project that you should begin at your first year and finish it by your fourth year. And then, you graduate. If you do the 6-year program, you do your first year of oral surgery as an intern, and then you go away for 2 years where you do your medical school. And then you come back as a third and fourth year, I believe, you do your oral surgery, and then your last year you can do your general surgery stuff or in between. It varies.
So it's basically pure medicine during those extra 2 years.
Yes. It's just exclusively, I think it's the third and fourth year of medical school.
And procedure-wise, you do mostly, depending on the hospital, you'll do more trauma or more orthodontic surgery, or there is really like a variety of all cases?
Yeah, you can do whatever you like to do. I'm just going to give you my example. When I went through my second year, I really was enamored by, the surgical aspect. I did a year of transplant surgery, and I saw these surgeons. I was assisting them in doing kidney transplants and doing venous anastomosis and fistula creation for dialysis. And I was really fascinated by all that and learn a lot. And then I did my rotation through ENT and had the opportunity to train under a great mentor who did a lot of head and neck cases. And that's when just before I started my third year, I knew exactly that I wanted to continue further in my training. That's why I decided to do a fellowship training in head and neck oncology and reconstructive surgery. And that was another process because, back then it was the application process was not that organized. So I had to essentially email every program, and that was back then it was about 6 or 7, my CV, and tell them that I was interested. So this is when I realized that having had an MD would have helped me a little more. And this goes back to what you and I discussed earlier. If you want to make that decision, do I go through the 4-year or the 6-year program? As a foreign trained resident, you have to do your dental school first and get your license first if you want to apply to the 6-year program. If you come like me, graduated from overseas, and then try to apply into a 6-year program, they automatically say no. But that's when you want to see yourself 5 years or maybe a year after you finish your program and see what you want to do. If at that point, which is very difficult, this is not an easy task. If at that point you say to yourself, I want to be an academician, I want to be in a hospital setting, like I wish I said to myself, you automatically say, well, I gotta get my MD. It's going to be easier. Is it mandatory? Absolutely not. In my case, I realized when I was applying to fellowship that a lot of the hesitation from those programs was based on the fact that I was a single degree. And it was only one program that invited me for an interview in Knoxville, Tennessee. And my mentor, Eric Carson, interviewed me. I believe he had interviewed a couple people, and he called me about a week later and he offered me the position, and I didn't even think about it. He said, hey, you want to think about it? Talk to your wife. I said, no, I'll say yes right now, because I know that if I miss this train, I'm never going to get on another one. So we made the move, lived in Knoxville, Tennessee for a year. I think it was the best thing I could have done, because if you ask me what do I enjoy the most of my specialty of my career, is just doing the big cases in the operating room. That's, we can speak at length about why some people don't like that and why is it so difficult, from the financial point of view, but it is what makes me happy, and, I enjoy it. So I did that, and if you go through that training, you want to stay in an academic position where you go into the hospital. And then going back to your question, what do we do? It depends on your interests. I have friends who enjoy doing orthodontic surgery, and this has to be done in a hospital setting, so they train for it, or they they start doing them and they feel comfortable and go for it. I do them at times when there is a direct referral to me, but my main interest is in diagnosing and management of head and neck pathology, and that's what I do. And obviously has to be done in hospital setting. While we are there, we have to manage whatever comes our way. If there is a trauma, if there is a deep neck infection, etc. And then you do whatever else you want. Some folks in our specialty focus on cosmetic surgery, and they do that. So it's whatever you want to do that has to be done in a hospital setting.
I see. And during that year, what is exactly the concept of a fellowship?
So a fellowship is just it's further training after you have obtained your certificate in whatever specialty. In the medical field, you go through you obtain your certificate of ENT or plastic surgery or orthopedic surgery. And then you decide to subspecialize in something even further, just narrow your scope of practice even more. So if you're an orthopedic surgeon, you may decide to do a fellowship in knee repair or in ankle, foot and ankle surgery, or in hand surgery. ENTs have the option of going into facial cosmetics. They have the option into going into head and neck, or audiology or otology or pediatric ENT, craniofacial. And in oral maxillofacial surgery, nowadays they're even more organized when it comes to fellowships. Head and neck fellowships. There are a few around the country. There's some general oral maxillofacial surgery fellowships where you can do an extra year of a little bit more and just become more skillful and comfortable doing certain things. There is the orthodontic and TMJ fellowship. There's fellowship in craniofacial also, but again, it gets more specific. There's also fellowships in TMJ surgery alone, and so forth. So that's what it is. It's just a further subspecialization in something more specific.
I see. And was it during that year that you felt that you decided you wanted to become more an academician and that was the path that you wanted to follow, or you knew it before?
Well, that answer, I was biased. Why? Because I knew that I didn't have a license to go out and practice. One thing that I've noticed is that I would say 90 to 95% of our residents end up going into private practice, just to practice the bread and butter oral maxillofacial surgery, join a group or opened up their own practice. And that is perfectly fine. I couldn't do that. And now, I still think that I wouldn't have done it because it was during that second year that I decided I had to take that path of doing further subspecialization and just, I fell in love with the head and neck oncology and the reconstructive aspect, the reconstructing the segmental mandibular defect with iliac crest bone graft and so forth. I really wanted to do that. And I knew that if I was going to go through all that training and then go in private practice, go outside and do private practice, it was going to be a waste of time. So that's why, I knew early on that I wanted to, that my safest choice was to stay in academics, but it was not because it was my only option. It was because I really wanted it. And I know some other people that have taken the other way around it. They finished their program, they went into private practice, and then when it came time to say goodbye to private practice, they joined the program and they became academicians and started taking call and seeing patients and doing other stuff.
Which is definitely two different lifestyles. I think you mentioned something that is key earlier, which is like knowing what you want and deciding what kind of life you want to have in 5, 10 years from now, because the life of somebody that works in an institution where you have to take calls, so you have to be at the hospital versus the life that somebody that is on a private practice. The two lifestyles are different. And also the type of practice that you're going to have is completely different.
Yeah, that's exactly right. They're very similar in a way because the private practice surgeon still has to take call for older patients, and a lot of them, if not all of them, I would say, they have to obtain privileges at a local hospital because if something happens to any of their patients, they want to take them to the hospital and they want to do that. It's certainly different lifestyles, similar in many regards. But I think the main difference when you compare the two is financial. Private practice is not a secret. Is way more lucrative than the life of an academician or academic oral surgeon. We could speak ad nauseum about that difference, and that's probably a topic for a different time. But that's the main difference is that financially speaking, you can be more you can obtain more of a financial reward when you're in a private practice. Let's put it that way.
Absolutely. And you also have the freedom. Like you really have the opportunity, like the more you work, the more you get, like in any setting. But I think if any particular situation is the gap is bigger is with oral maxillofacial surgery. I've noticed that. And maybe that could be a reason why there's also not that many people going into academia.
Yeah, absolutely. It is a good point, and I can only speak mainly for our program, and we're certainly a small program. Interestingly, pretty much everybody, full-time and part-time faculty in our program, except for maybe a couple, are all Tufts graduates. So that that's says a lot. we try to recruit and keep some who are willing to enjoy a little bit of academic oral surgery. And a lot of times, I feel grateful for those members of our specialty who are in the community doing private practice, and they still are willing to take call, here and there, and to bring cases for the residents to get benefit from and learn from. So I think it's great, and it allows you, our specialty allows you that.
Yeah, that's a great thing. And I'm curious, after that year that you went to Tennessee, then what happened? What was in the end of the year? Now it's decision time.
Yeah, absolutely. So, it was it's good to go back and think about it, but honestly, I mean, I just, I want to keep them right there where they are, because it was very stressful, and you can imagine, two toddlers, my wife, and I was finishing up in early 2010, and I had no, I mean, we were looking around, but in reality, I needed to somehow get my license here in the States, because otherwise I wouldn't have been able to practice. So I was fortunate enough, a former resident that was my chief resident when I was training at Tufts, she had become a faculty during my last year of training, and then when I left, she called me up one day and she said, "Hey, I have to leave. Unfortunately, my husband got another job, and we're relocating. And I just wanted to tell you this first, because I think that you're the right person to take my position. And I just wanted to get some insight of what are you thinking." And I said, "Well, listen, my mentor had been talking to a bunch of other programs in multiple areas, but I'm very limited. So, I mean, if Tough is willing to give me an opportunity, I mean, I'll certainly work my butt off and try, do whatever I need to do." And that's what happened. So I was offered a position as faculty, and with that comes the possibility of doing the faculty track, and do some your equivalence to get your degree, and that's what I did. And so that's a process that began in 2010 and finished somewhere around late 2013. And it worked out. It worked out that way, and that brings me back to the option. Just a fun anecdote that happened related to that. When I was interviewing for the position after halfway into my intern year at BU, the program director, during the interview, he asked me, "Don't you think it would be best if you go back to dental school, finish your 2 years, and then apply to oral surgery?" And I looked at him, and I was thinking to myself, I understand that that's what would be ideal and would make my life easier and maybe open more doors. But at that point, I was not thinking about anything other than becoming an oral maxillofacial surgeon. In fact, if I had the opportunity and I went to my training, I would have gone back to Venezuela and practiced there. So that's the reason why I didn't do it that way. But if you ask me what I would recommend somebody do, get your license first and open more doors, and then you'll have the luxury to decide where to go, and you don't depend on the option on those little options to come to you, if any. So that's that's what happened.
Yeah, and I think it makes a huge difference if you know already from the start that what you want to do is to stay. I don't know if that's, I mean, you probably didn't have the certainty. For me, I didn't even know. I just came for a specialty. I was just so narrow-minded into option, and I was just thinking, this is what I want, and I couldn't see any further. And I agree with you 100%. Even taking the board exams and all that, like I dragged that as late as I could just because
I did it too. I mean, I was taking those boards after I had already completed a fellowship in Oncology and Reconstructive Surgery. I was taking the dental boards, and then imagine if I tell you a story of when I was taking the licensing exam, the rep that I took. Oh, it was that painful. But yeah, I mean, it's it's better if it's done that way, the way that you and I didn't do it.
Exactly. Like, don't follow this up.
Exactly.
Oh, after you have done so much, it was the same for me. Like after being here, finishing residency, fellowship, working, having to go back and study for boards, and then going back to a typodont or to a patient to do operative and root canals and all that for licensure exam. It's a nightmare.
It is. It is. I remember that being the worst weekend of my life.
I recently took the CDCA, the equivalent now to nurse. So I know exactly what you feel. Oh, I can feel it.
Yeah. It's terrible.
Yeah. So you came back, and that's how your life and career at Tufts started as a professional, like as a professor. And
Yeah, I just turned 10 years of being faculty there, still an assistant professor. Um, I mean, I'm very grateful and still humbled about that whole thing, and I love it. And I've had a lot of opportunities come knock my door, of going somewhere else, but I just I feel comfortable because that's the place that saw me develop, and I know a lot of people, and doing what I do as a single degree, as a DMD. Um, is not easy, and it wasn't easy to get it to make it happen at Tufts. So it will still be very difficult for that to happen at any other institution. The ability to manage the head and neck cancer patients and do all these procedures, it's not that easy. So I enjoy it. I still do, and I'm very happy.
you currently do private practice as well?
Yeah, that is something that as much as I mean, if there's somebody trying to avoid it, I mean, I think that, is you have to accept it. It is an opportunity to work on the days that you don't have to work, as an academician, and see patients. And like I said, the financial aspect, I mean, it just, it helps, overall, because, there's one thing that we don't teach our residents during residency, and I certainly didn't learn it, and I learned it as I went, once I became faculty, is the billing aspect, the healthcare system aspect of what we do. And being going back to the comment that I mentioned, oral and maxillofacial surgeons being a hybrid, we take both dental and medical insurance, and that has been the most frustrating thing for me, is to having to learn and deal with it. It's just something that I wish I had known a little bit more about it when I was going through my residency. But as a resident, you don't bill, you don't care, and you don't pay attention to those details. And this is what I had to realize the hard way, and learn the hard way, that spending 6 hours doing a case in the operating room, and then realizing that the insurance reimbursement was about 20% of what you actually bill, is an eye-opening experience. And that's why when we compare the two, going to private practice and doing the bread and butter, the cases, in 6 hours of a full day in the OR, I would probably do 12 patients, in a private practice, and you can see the difference there.
Of course. And
So, there's
you mentioned at the beginning the big difference between oral maxillofacial surgery in the US, which is very unique compared with even other countries, is the fact that because you have so medically involved, you also are able to take insurance. Like in many countries, you can't.
exactly. And it's interesting you bring that up again, because we've had a lot of externs come visit us from Europe, and when they come see us and they see what we do in a private setting, we sedate people, we provide safe ambulatory general anesthesia, and we are so deeply involved in the medical aspect of our the management of our patients. They are very surprised, because they go like, listen, I mean, where I come from, you have to go through medical school. Even if you went through 4 years of dental school, you have to do your 4 years of medical school and then become a oral maxillofacial surgeon. And even then, they cannot just go into a private practice and in a building, opened up a private practice, and then sedate patient there and have their own ambulatory centers. It's it's a very unique thing that we have here in this country when it comes to oral maxillofacial surgery.
And in terms of dentistry in general, did you remember having any shocks or noticing that dentistry was really different here than in Venezuela?
I have to say, I mean, dentistry in Venezuela is well, I mean, the time that I trained there, and the people that I talk to that are still there, I mean, I still think that is very high compared to other countries. Um, Here, I mean, I do feel, and I don't know, it's that difference of a year. They do the 4 year here. We have the 5 years with the externships that we do and all that. I think that there is a little bit of a less um, uh, confidence when it comes to the students here graduating and making that jump into private practice directly. This is why I was surprised when I came here. They have this GPR and AGD programs that we don't know about when we are when we come out of dental school in our country. So yeah, I was a little bit shocked by that.
Yeah. I think that you're right, and part of that is the fact that they only practice really for 2 years, which that makes the clinical time quite short. And they have a lot of other activities too. I like calling them opportunities because they definitely have more opportunities, but they get involved with a lot more things during dental school that I cannot imagine when I was in dental
Yeah,
school. I could do so much other things. I felt like I already didn't have time for what I was doing.
I agree.
Yeah, I think a dental student is involved in research and in organized dentistry, and they run meetings and they have all these things that I really don't understand how they do, but they do it successfully. But yeah, that reduces their clinical experience and gives opportunity for other programs as well for them.
Yeah, and I also noticed that when a dental student develops early interest in a particular specialty, and in my case in oral surgery, they start showing up in year two of their career, of their education, and they start showing interest, and then by year three they spend a couple of weeks with us, and they start rounding with the residents and coming to the OR and watching cases and going to the back where we put people to sleep, and they show that interest. They want to be involved in paper publication early on and present at conferences, so they can they get noticed. And that's the other thing that we need to fight against when we come from overseas. We haven't had the opportunity to do all that, so you're competing to somebody who has been doing that for 2 years before you showed up and tried to apply.
Yeah, which can be maybe the piece of advice for somebody coming from overseas is try to find opportunities that we shipping have visibility. And those you
Exactly.
have to put your time and just be there and show up without it.
Exactly. That's exactly right.
Yeah. Do you have any other piece of advice, or let's say going back in time, then now that with all the 20 years of experience that you have in this country and all the things you have seen and learned from the practice perspective and the educational perspective, if you could give a piece of advice to that international dentist coming to the US and thinking on a career in oral maxillofacial surgery in the US, what would it be?
Well, the main thing is just know enough of what you really want to do, and then make a decision. So if that person, he or she, comes already with their mindset of becoming an oral maxillofacial surgeon, then my advice is to try to do a couple of internships and just I mean, obviously, ideally would be to become an intern like I did, but it is challenging. So going back to get your licensure straight up first. If you can do the international student program for 2 years, go for it. If you are able to get into a university and become faculty, and then go through that door, then apply later, go for it. If you cannot do any of those, then try to do a couple of externships at different programs. Tufts offers externship for foreign trained dentists, or even current students. And just see how we work here, see how the program is, and learn more about it, and show yourself, and demonstrate that you're interested, and then do it that way. but it's better to do it while you're here.
Yeah.
Don't expect to come here as on a 2-3 month vacation and then just do it and then go back, because it's very difficult and it's probably not going to happen.
Those things actually take a little time. And I think it's something that we don't realize in Latin America. We have this shallow sense of time and think things just happen very quickly.
Yeah. No, nothing happens that quickly, especially nowadays. I mean, imagine this year it was our first year doing interviews via Zoom, and it worked out, but we would have never thought that, it was going to come the time that residents or applicants wouldn't have to come and do a real visit to the hospital and the institution.
Yeah, a lot of things will change, and I think a lot of things will permanently change in the after this year. But thank you so much, Dr. Oreadi. It was great knowing a little bit more about your story and hearing your advices for people. If you want to have a final thought or anything else that you would like to share, mic is yours.
Well, no, thank you so much for having me. This is great, and I love the fact that I was able to give some advice. And the only thing I want to say is that I'm open to get contacted by anybody who wants to know more about my specialty and who's interested about it. Feel free to provide my contact information, because I'll be happy to assist in any way.
Okay, that's fantastic. I'll make sure that I'll leave the contact information in the description box for people to reach out.
Excellent.
So, thank you so much.